At InHealth Clinical Documentation Solutions, providers can quickly capture dictation for patient encounters from their mobile device. Upon login on the GoDictate app, providers' patient schedules appear in the palm of their hand. Once in the GoDictate app, providers can choose a different data service utilizing a drop-down menu. When the correct data service is selected, providers choose a patient ready for dictation. After the patient screen populates, providers have the ability to review additional patient information. When the provider is ready to dictate, selecting the record button will start the recording process. Providers will begin dictating and tagging the sections of the encounter they wish to dictate: encounter reason, chief complaint, physical exam, review of systems, HPI, plan, and discussion notes. Upon completion, providers have the ability to listen to the completed dictation by choosing the play option. Providers at this point can choose to insert or record over if any changes are needed. When the provider has completed the dictation and selects the Submit button, GoDictate will let them know that their dictation has been submitted. Upon returning to the patient screen after submission, the patient will show green. By choosing an additional patient, providers can begin dictation. If they choose to dictate for this patient and don't hit Submit, our app will display this patient in purple for a quick reminder that this patient's dictation needs to be submitted. Completing the workflow, I will now transition to AthenaNet. Once a provider logs into Athena and chooses the clinical inbox located underneath the patient tab in AthenaNet, the dictation status is shown under the encounters column. You will see that Dr. Murray has 2 encounters with notifications, one showing transcription complete, one showing as pending. By clicking on Dr. Dawson, you will see an open encounter. By choosing the patient under Dr. Murray showing a description as transcription complete, a provider can review his notes. If there are any edits or changes needed, providers can click on the section where the edits are needed. Also, dictation and transcription exchange between InHealth and Athena will always be communicated with a time and date stamp located underneath this section. When the provider is ready to sign off, they will simply utilize the encounter sign-off located within the patient encounter. Another avenue for reviewing dictation status is the dictation queue. This queue will show in one location the status of all dictations sent to InHealth and provide search capability. By choosing to search all dictations, I will clear the search criteria and hit Submit. This will populate all dictations sent within AthenaNet. By clicking on dictation status, the system groups the status. To review the encounter corresponding to the dictation, click on the hyperlink underneath the appointment type. This will open the encounter for review and sign-off. For additional information and to learn how InHealth Solutions can streamline your provider's workflow, please contact us today. We look forward to being your partner in practice.